And joining me now is a very special guest. I'm joined by the chair of the South African Medical Association and one of the first doctors to identify the Omicron COVID strain. Dr. Angelique Coetzee joins me from Pretoria. Thanks very much, Dr. Coetzee, for joining me. The world is spooked by this new strain, Omicron. As one of the first doctors to identify it in South Africa, what's your sense? Is it as fatal, as dangerous as is being suggested by some? The World Health Organization saying it carries severe risks?
Good evening to your viewers out there. And yes, you know, it is very interesting. It's very, very early days with this viral, with this variant going forward. So I think what one needs to understand, the fact that it's got the 30 plus mutations, that is what is, I think, scary to the world. So the world wants to know, will our vaccines be effective? Will we see a lot of severe cases? And will our systems again be overflow with sick, very, very sick patients? So the short answer is, up until today, the clinical picture at the primary healthcare level is that of mild disease. However, we're not saying that it's going to stay like this. It might change going forward. As for now, most of the patients that we are seeing are young people under the age of 40. Today, I have seen about 5, I think, positive so far, of which 3 are children 13 and younger, but they're not severely ill. And the 2 adults that I've also seen, young people, also not severely sick. So hopefully, the clinical picture will not change a lot, but we know that's highly unlikely. So because once this virus hits the unvaccinated patients with comorbidities and chronic diseases, that's when we're going to know what is actually happening. Yes, it is fast spreading. We're not denying the fast spreading of the virus. But the problem is going to lie in the severity. And for now, it's still too early to say how severe. We can only say that so far it's mild cases. And by saying it's mild cases, we're actually trying to make the public aware. Because the symptoms are so mild, that you might have underlying COVID, please go and check yourself out with your healthcare practitioner. Right. We're not saying that so that you can relax and do nothing.
Dr. Coetzee, you're saying something very important to us. You're saying most of the patients you've had so far are young, some as young as 13 years. You're saying that the symptoms in most of the cases have been very mild symptoms, but you're not ruling out the possibility of severity in the future, particularly because of the number of mutations of the Omicron virus that is feared. Give us a sense of these symptoms, Dr. Coetzee. What are the symptoms that you've noticed in Omicron patients?
The Omicron patients, what don't they have? They don't have loss of smell, loss of taste, a very stuffy nose, a terrible cough, and at this stage, we don't see them or either with having oxygen problems. You know, we call it the SATS monitor. We don't see that now. And in your COVID Delta patients, that is on the foreground. You know, it's the smell and the loss and the general, they're really not feeling well with the cough and the blocked nose. But in these cases, they would describe the throat as a bit scratchy. I have not got one that says to me, I've got a severe sore throat. The ones that did come in with a sore throat was not positive. So we ruled that out. And it's also the cough. The cough is a very, very mild, dry cough. It's more like an irritation, and it's not there the whole time. So they don't even focusing on the cough. for them, it's more the malaise. They're not feeling well, the body aches and pain and the headache, and the tiredness, the fatigue.
Okay, so fatigue is what you're seeing. You're seeing scratchy throats, but not severe. So that in a way is reassuring, but the real scare, I think, across the world, Dr. Coetzee, is that the fear that this particular virus strain could actually bypass vaccinations. Now, the people who've come to you, have they been all vaccinated? Those who've been infected by this strain, are they all vaccinated, or are they usually unvaccinated?
So very interesting question. What we are seeing is that mostly unvaccinated or not fully vaccinated. But we did see vaccinated people, and even those vaccinated people have got very, very mild disease. And most of them that we have seen breakthrough infections got their last Pfizer shot around about August. So we haven't seen people who got being vaccinated in September or October this far. But that data will come out within the next 2 weeks, because it's compulsory for us to report to our NICD's labs and so, or surveillance team, and they are linked with our vaccination register. So that data will come out and see what we are seeing here, whether that is the norm that's been seen outside.
So is the world being needlessly alarmist at the moment? Has the world overreacted? The World Health Organization already describing it as a variant of concern with high risk. South Africa or Southern African countries finding themselves increasingly being isolated by other countries in terms of travel bans. Do you believe that's an overreaction, given that you're telling me that so far the symptoms are mild and presumably do not require hospitalization?
Yeah, remember, there will be patients that is being hospitalized at this stage, but it's really not a lot. And in the public sector hospitals, there might be more. I know that the children are more being admitted in the public sector hospital. But in the private sector hospitals, adults this far, especially the older population, has not really been, there's not really an increase. Not at this stage. That might change going forward. So, regarding everyone, trying to cut South Africa and the rest of African countries out and put travel bans in, the question is, after we have alerted the rest of the world about the variant, as well as the lot of mutations, and we're trying to say the clinical primary care level, we're not seeing severely ill patients. So that doesn't mean that you need to lock down everything. It doesn't mean that we're never going to see very severe cases going forward. It also doesn't mean that we are only going to see severe cases going forward. It just means go and look in your own backyard, go and see and be aware, and you will see, I'm quite sure it's already in your own countries, and not, I mean, only your countries, but in the first world countries as well.
Right.
Go and check and see.
That's interesting. You seem to, again, there suggest that possibly the variant is already there in the backyard of most countries. It's not uniquely South African. But Dr. Coetzee, the worry, of course, as you said, is the number of mutations that this virus could have, and some of them could have severe consequences. The other worry, from what you're saying, is children, because so far we've seen, particularly with Delta, children have been mostly protected. You seem to suggest that there are children, mainly unvaccinated, who could be troubled by Omicron. Am I correct?
So South Africa only recently started to vaccinate 12 years and plus, and I think about 400,000 12-year-old till 17-year-old has been vaccinated. So not a lot of them had been vaccinated. We don't vaccinate the children under 12 at this stage. And then the second thing is, during the third wave, we never actually tested the children. We only started now with the lessons learned from the third wave to start to test children. So it is a very uncomfortable type of test to do a nose swab on a 3-year-old child. It's not easy. It's very traumatic for the child. So, but lessons learned, as we said, okay, let's try from now on, we will test them. And that's exactly what we do. So now we are picking them up earlier, which maybe they were there. And again, remember, children is not getting that ill.
No, but could it be, Dr. Coetzee, that children, while they're not getting very ill, are perhaps more susceptible to this new variant, given that they've been unvaccinated, given that this is, as you're saying, possibly a milder strain?
Yes, it can. You're right. It can. But the time will only time will tell us about that. So yes, and we know that children are normally the carriers as well. But the fact is, we are testing the children now, which we never in the past really did on a major scale.
Okay.
So that makes a difference.
Now, going ahead, do you believe it is going to be more infectious and potentially lethal? Or again, are you saying we should hold our horses on that one? Let's not alarm the world by saying this virus is going to be far more infectious than Delta. Are we at any stage in a position to compare it to what Delta has done to the world?
We're not at that stage yet, but the scientists will give you the RR value, and they would say, yes, it's quite, fast spreading. Fast spreading means more, infectious. But the real question lies at the end of the day on the severity. So you can have a very fast spreading virus infection, not very severe. People are, treated easily. They can be treated at home. And that's the first price. Or you can have a very slow spreading virus with severe infections. And that is not good. Or you can have a fast spreading virus with severe symptoms, and that is a disaster. But at this stage, it's too early to say, except to say, yes, it is a fast spreading virus, but how virulent, how sick is the virus going to make you? That data will only be available within the next week, this week, and the coming next week, whether we get a better picture of what is happening. We hope that we will get a better picture. Otherwise, it's still going to be mild.
Therefore, let me ask you in conclusion, Dr. Coetzee, what is your advice to those who are out there spooked by this virus, worried about what it could do? What's your advice to them to stay patient, to stay calm, follow all the existing COVID protocols, presumably, the masking, the social distancing? Are you saying that just follow the existing protocol? Is there a particular group of people who should be more worried, those with comorbidities?
So yes, you need to do what we call non-pharmaceutical interventions. We have been saying this for how many months now, and I presume exactly the same in your country. And then we say, get vaccinated, especially if you are above the age of 50 with comorbidities. If you're younger than that and you already have comorbidities, you should have been vaccinated by now. And then get your booster shots as per your country's policy. Stay away.
Would you recommend a booster shot? Are you saying vaccinate and get a booster shot? That will give you complete immunity in a way, or as much immunity as you can hope for?
As much as immunity as you can hope for. Remember, we are vaccinating people to keep them out of hospital. We're not vaccinating people to alleviate mild disease. We vaccinate, the major objection the thing about getting vaccinated now is get them out of hospital, get them as much as possible to get mild disease and not severe disease. And if we can get that right, then we are quite far. But I'm going to say again, if Africa is not vaccinated, no first world country or any other country outside of Africa can sleep peacefully at night, because that is where the variants are going to start. That's where your mutations are going to start. So as much as you vaccinate your own country with I don't know how many booster shots, at the end of the day, if you don't look at Africa, it's always going to be your nightmare.
I think those words are very cautionary. They're not alarmist, but they are cautionary. And I think that perhaps is the spirit with which we need to look at this new variant. We need to be cautious, we need to be alert, but not necessarily alarmist. And for now, you're telling us the symptoms, importantly, are mild. And that's reassuring in a way. Dr. Coetzee, for joining me there from Pretoria, thank you very much here on the news today.
Thank you so much, and please stay safe.
Thank you.